Now we're going to talk about the Lamaze philosophy of birth, and it includes 6 healthy birth practices that we highly recommend you consider when you're planning your birth. The first one says, let labor start on its own. Now, this is really important because the body is created to grow your baby and to birth your baby. And in our society, it is not uncommon for providers to want to induce everybody at 39 weeks. This is here in the United States. Of course, it's different in each place. But a lot of providers want to do this whether you have a medical indication or not. However, this is not the recommendation of ACOG. ACOG is the American College of Obstetrics and Gynecology. They recommend that women be offered an induction at 41 weeks, so after you've completed your whole 40th week, and that all recommendations for inductions be started at 42 weeks. Now, you get to choose where you want to take the risk. You have to kind of decide. So speaking with your provider is really important, okay? The reason there's really an issue if you don't let labor start on its own and you go in for an elective induction is that if you start with one non-medically necessary intervention, it can actually cause other non-medically needed interventions. And we're going to get more into that later. The second one is to walk, move, and stay upright during the labor process. Movement during labor is really important because it helps the baby to rotate into the ideal position. And it also helps your pelvis to move and shift to help facilitate that movement for baby. Okay. And so as things progress well, that movement is usually helping it. If you come in and you get an epidural and you're just laying still the whole time, then that can be a challenge. But there are so many different ways that you can move and reposition even with an epidural. So don't think that just because you get an epidural, this one is out the window. It's absolutely not. We can work closely with you. Number 3 is to bring a support person, significant other, or a doula with you when you come into the hospital. Studies have shown that when you have continuous labor support during your whole labor, it actually decreases your chances for a cesarean delivery and for an epidural. Having that support is really important. Number 4 is to avoid interventions that are not medically necessary. And the reason this is important, for instance, if you decide to get an elective induction. Well, with an elective induction, there are more interventions that come along with that, like an IV and fluids and monitoring. And those interventions can cause even more interventions, right? Because it might decrease your mobility and decrease your ability to cope. And then if that's the case, then you're more likely to get an epidural. So just be very mindful that one intervention doesn't normally just come by itself. It usually comes as a package of different interventions. So make sure you speak with your nurse and your doula and your provider about these things when they ask you if they can do different interventions during your birth process, okay? Now, of course, if you have to have an induction for a medical reason, this still does increase your chances of needing other interventions, but you kind of have to do what you got to do, right? Because we're constantly weighing the risks and the benefits. And where we find that there are more risks, then we have to be mindful of that. And again, our communication with our provider so that we understand the risks, benefits, alternatives to interventions in terms we understand. Very important, okay? Number 5 is to avoid giving birth on your back. By delivering on your back, you increase your chances of having a severe perineal tear. So that's like a 3rd or 4th degree laceration. And we're going to go over lacerations here in a little bit. But you also increase your chances of having an episiotomy if you're in this position. Because of the way the pelvis is positioned on the bed when you're on your back, it is not ideal for the baby because it won't open up as freely. So being tilted, being more upright, being on your side, those are all great positions so that you can give birth and allow your pelvis to move in the way that it should to help accommodate the baby being born. Number 6, keep mother and baby together. This is better for mom, for baby, and for breastfeeding, okay? Now, after the birth of your baby, they're likely going to place your baby on your abdomen, dry them off, and place them on your chest. The goal is to have at least 1 hour or until the completion of the first feeding before the baby is removed from mom. Now, obviously, if there is some kind of medical indication and the baby needs to go to the warmer, or mom needs some serious medical help, then dad can do skin to skin, or the baby will be under the warmer for the assistance that they need. But that first hour, it's called the golden hour. And I really talk a lot about this in the breastfeeding course. So make sure you go visit that one because it's so important. It really helps with imprinting of hormones for mom, like oxytocin to help decrease hemorrhaging and to increase bonding, and prolactin to help with milk production. And also, by having the baby skin to skin at this time, the baby can work their way to the breast and have their first breastfeeding, usually within the first hour, hour and a half. Request that all things that the nurses need to do with your newborn be delayed until after that first feeding, and ask that they be done while the baby's on you, or at least in the room with you. Now, there are some hospitals that insist they can't do some of these things in the room and that they have to take the baby to the nursery. One of the things that we recommend you ask is that you, as the mother or the other parent or support person, can go with them to the nursery so that you feel like there's somebody with your baby the whole time. On occasion, you might hear them say, oh, it's a HIPAA thing. We can't have you in the nursery. So there are two options here if this is the case. One is that you could stand at the window and watch them do what they're doing. Number two would be that you ask them to wait until there are no other babies in the nursery, and then have them care for your newborn so that you can go into the nursery with them. So those are a few of the options, okay? Now we're going to do a quick recap of the 6 healthy birth practices, okay? So the first one is to let labor start on its own. The second one is to walk, move, and stay upright during the labor process. Number 3 is to bring a support person, significant other, or doula with you to your labor. And number 4 is to avoid interventions that are not medically necessary, okay? 5 is to avoid giving birth on your back. And number 6 is to keep mom and baby together. It's better for mom, baby, and breastfeeding.